If you've been sitting all day in something like this, you probably got issues with stiff hips and painful hip flexors. Sitting tips the pelvis forward, shortens the hip flexors, and turns off the glutes. Over time, prolonged sitting can cause anterior pelvic tilt and also lumbar compression, as well as pinching when you're getting up to stand and walk. For this first exercise, you're gonna need a band. Get into a tall kneeling position and make sure that the band is anchored at the height of your upper thigh. Anchor the band to the top of your thigh where your butt cheek and your hamstring meet. This is gonna be the working leg. You wanna pull back a little bit to create a little bit of tension in the band. You want the band to be pulling directly in front of you. Now you're gonna take your other leg and place it on the floor. Make sure that your back is straight and your torso is not turning in any way. As the band is pulling, you're gonna lunge forward slightly and then slightly tuck the pelvis and squeeze the glute at the same time. You're gonna hold this position for like 2 to 3 seconds and then come back out. Do 2 sets of 8 to 10 reps per leg. This restores true hip extension and lets your glutes do the work instead of your lower back. And because of this, standing tall feels smoother and less pinchy in the front of your hips. This next drill is gonna reset the pelvis and the rib cage after hours of sitting. Grab yourself a yoga block, a towel, or a foam roller. Also lie your mat up by a wall. Lie down on the mat and make sure that your feet are hip width apart. Your toes are going to be pointing straight up. Also make sure that you have a nice 90-degree angle bend. Take this yoga block and place it in between your legs. Now, if you have an arch in your back, you do want to tuck your pelvis. This is only to make sure that your lower back remains glued to the floor the entire time. Squeeze the yoga block with your knees and then press your heels into the floor. You're going to hold this and breathe normally for 5 seconds. Perform 2 to 3 rounds of this. It repositions your pelvis, re-engages your abs. It also downregulates those tight hip flexors so that your hips can extend more freely. This helps standing, walking, and even climbing the stairs so much better. Now we're gonna work on engaging the glutes without the lower back kicking in. Lie on your back, knees bent, feet hip width apart. If you happen to have an arch in your back, make sure that you tuck your pelvis only enough to where your lower back touches the floor. Now you're gonna take both hands and hug your knee into your chest. Keeping this position, making sure that there's no tilting going on with the pelvis or the hips. You're gonna squeeze the glute and then you're gonna press up. You're gonna hold this position for 2 to 3 seconds and then come back down. You're gonna do 8 to 10 reps of these per side. This forces true hip extension from the glutes and then blocks that hip flexor lower back compensation. This translates to better functional movements without your lower back taking over, using your glute as the primary strength driver here. If these hamstrings are always tight, let's make those glutes do the work instead. This dynamic bridge forces pelvis control and also causes the glutes and the hamstrings to stabilize. Keep your feet hip width apart. Also make sure that your lower back touches the floor. Then place your hands on the floor here. In this position, you're gonna squeeze the glutes and you're gonna press up. Now, what your goal is to make sure that this pelvis and the hips, they don't rotate or move. You wanna keep them nice and square. From this position, you're gonna gently walk out 3 to 4 steps. You're gonna pause, and then you're gonna come back up. If you did this movement right, you felt your glutes and your hamstrings fire. And because you kept that pelvis tucked, you didn't feel it in your lower back. Now we're gonna open up those tight hip flexors. For this exercise, make sure that your feet are hip width apart. Now take a wide step back. You wanna make sure that your knee is gonna track in the middle of your foot, not over for this exercise. You're gonna bring your opposite side arm up, and then you're gonna tuck the pelvis slightly and come down and hold. You're gonna hold this for 2 to 3 seconds, and then you're gonna come back up. Do 2 to 3 sets of 6 to 8 reps per side. That overhead reach connects that hip stretch all the way through the rib cage to the shoulder. This trains the whole anterior chain to lengthen while the glutes extend the hip. So instead of feeling that front hip pinch, you'll feel more power in those glutes and less compensation in that lower back. This trains those glutes to resist lateral rotational forces that long periods of sitting have jacked up. Let's make these hips, not the lower back, do the stabilizing. You want to anchor the band hip height and you want to wrap it around your hips. Now you want to step out a little bit because you want to have a good amount of tension in this band. Keep those hips forward, no turning in the torso. Also keep your back straight. You should feel this movement all in this leg right here. You're using this to stabilize and resist the whole entire body from coming in as you're taking this small step. Do 2 to 3 sets of 6 to 8 reps per side. This strengthens both the glute medius and the glute maximus to stabilize that pelvis. Not only does it spare the lower back, especially that QL area, it also fixes those knees caving in. And that translates to more stability when walking, pivoting, with no awkward low back shifting. These drills teach your hips to extend and stabilize dynamically so that daily movements feel pain-free and more powerful.